We have in our community individuals, families who are hardworking. They don't make enough money to really support their medical needs.
As I understand, there are 75,000 to 90,000 working uninsured in Jacksonville and the Jacksonville area.
The biggest cause of bankruptcy in this group is a medical emergency.
There's a great divide in our society between haves and have-nots with regard to medical care. If you have money, you can get good care. If you don't have money, sometimes it's very difficult.
And these are good, hard-working people that in some cases have had some bad breaks and just looking for a little help.
Imagine being ill. Imagine not being able to afford a doctor. Each year, more citizens from every area of our city find themselves medically underserved. But Volunteers in Medicine finds a way to help. Volunteers in Medicine, or VIM for short, was created in 2003 with a simple mission: assurance for the working uninsured. Volunteers in Medicine provides primary care, preventative health care and education, lab tests, and most prescription medications, all at no cost to our patients.
We're seeing about 500 patients a month. We've seen over 35,000 patient visits since we started. So it's about 6,000, 7,000 patients a year.
This is a group that's forgotten. They don't make little enough to have government assistance, but they don't make enough to be able to afford health care. And we can help keep them out of the hospital and keep them healthy.
We're keeping people out of the emergency room. The average cost for an emergency room visit is $1,700. And eventually, as taxpayers, we pay for that. So we're, in a sense, we're saving them money. And then also, we're giving the patients the care that they need, continuing care, not just one ER visit.
One of the biggest things we do is take people that work as hard as they possibly can and give them what they don't have the opportunity to get, and that is accessible health care and preventative health care.
Individuals seeking assistance from Volunteers in Medicine must first apply and qualify. They must be without private or government-funded medical insurance and meet specific guidelines for income and employment.
We look after people whose income is between $13,000 and $27,000 a year. They must have a job and live or work in Duval County.
When I qualify the folks, I get to see the people that are coming in for the first time, and oftentimes they're tentative, they're a little bit afraid, and I can sense that they're afraid that they're not going to be qualified, they're not going to be able to get the care. And when they do meet the criteria and they meet the minimums, you can see just a sense of relief in their face.
I hear sad stories that are so sad sometimes you just sit there and cry, because they aren't making these stories up. These are real-life stories. And when you hear those stories, you can't help but be touched by it.
Okay, my name is Angela Rosso. I have been sick with infection, and at the beginning